Namaste and hello everyone. On behalf of Apollo Hospitals, I'm delighted to convey our warmest greetings to all of you on International Women's Day. This is Dr. Srinidhi Chidambaram. We have a very special day ahead with a marathon of Facebook Live sessions that we have curated so that several aspects of women's health are discussed with our top experts from Apollo Hospitals. International Women's Day is a global day, as you know, celebrating the social, economic, cultural, political achievements of women. It's also meant to support women in their journey to success and achievements. One such stated mission is to assist women to be in a position of power to make informed decisions about their health. The key word here is informed decisions, and that is what is most difficult to achieve today in this era of social media misinformation and unsafe and inauthentic resources. An area of health where it is even more vital to have authentic and factual information is aesthetic and cosmetic health. We as women pride ourselves in looking good. We make efforts to be the best versions of ourselves, and a good part of that is about the skin and the hair. And this is where myths and misconceptions and a plethora of hair treatments and supplements abound. Everyone is an expert when it comes to hair care, but we need to know what actually works. So today we are going to ask one of the most experienced and renowned dermatologists in our group, Dr. Muralida Rajagopalan, to give his insights to us on caring for our hair. Dr. Murlidhar Rajagopal is a senior consultant and coordinator at Apollo Hospitals, Chennai since 1990, and he has over 34 years of experience in academic dermatology. His main interests are clinical dermatology, immunology, skin as a manifestation of systemic disease, and psoriasis, amongst others. He has won several awards nationally and internationally, and is the recipient of 8 auditions so far. He's India's representative in the International Psoriasis Council and on the board of directors of the International Society of Atopic Dermatitis, a visiting professor at Rutgers University in New York on vasculitis. Welcome, Dr. Muralida Rajagopalan. I'm very happy and honored to have you on this series. So let's begin with a brief overview from you on what constitutes good hair care.
Thank you very much, Dr. Srinidhi. It's actually more of an honor for me to be honored by wonderful women like you on International Women's Day. So please do accept my greetings on International Women's Day to you and all the great women who are running the show in this country and abroad. God bless you all, because without a lady, there is no existence in humankind. And I'm very grateful that you have been here, and we are able to at least do something good on International Women's Day, which involves my little contribution. Thank you for the good introduction. And yes, I have begun my career with Apollo Hospitals. And I was before that, I was in PGI Chandigarh, and I transited straight into Apollo Hospitals, and I've had a good innings, and I'm happy to be here as part of the Apollo Hospitals group and have a wide reach where we can get in touch heart to heart with all the women who are reaching out through this kind of a program.
Absolutely, yes, please.
And when you talk about skin and hair, of late, most people think skin and hair is a very external issue. But from the beginning, we have realized that skin, hair, nails, the oral mucous membranes, all these are part of one single system in the body, and that is what we call as the integument. I will try to avoid too many technical terms in the course of today's discussion, but the entire integument is under the ambit of the view of a good dermatologist. The dermatologist can specialize further and look after just the hair or just the nail or just the outer skin or just the face. And there are dermatologists who specialize just in looking after your eyebrows. So for me, when you practice at Apollo hospitals, it is a more overall integrated view that I will try to present. The topic that we are talking about today is hair care, and with that automatically comes in is hair loss. So that's the topic we are actually going to talk about in today's meeting.
Yes.
To just give a very, very brief overview, Dr. Srinidhi, before you start the ball rolling with your questions. Amongst women who come to me for consultation in dermatology, I would say that about 20% of the women are worried about them losing hair. And it is not age specific. It can be right from the teens right up to women at the age of 60 or 65. Incidentally, today, people of the age of 60 and 65 are considered young because life expectancy and productivity has increased over the years. So I do not think that, as was in the past, maybe about 50 years ago, we should be dismissive about these concerns. These are genuine concerns. And the way we are groomed, the way we are brought up, the way we present ourselves does make a deep impact on how we are going to deliver our intended goals and objectives.
Yes.
Hair is an extension of your skin, and these are what we call as appendages. An appendage basically means an extension, a part of the skin. And hair grows all over the body, but over the period of eons of evolution, the amount of hair on the body came down. So if you look at our ancestors, the apes, they were covered with hair. The ancestors before that were also covered with hair, but they needed that hair for an important function, and that is either camouflage or to protect themselves from heat and the elements of the weather. But we human beings are so advanced that we have physical control over all that. So over a period of time, you will find that the amount of hair required in the body actually comes down, except for the scalp, where it becomes an aesthetic requirement, until and unless we are ready to support and accept the hypothesis that maybe 2000 years from today, all living beings, if they do exist, will have not a strand of hair on the body. But as of now and today, the hair is a very important and vital organ in the body, and it contributes greatly to a sense of social and emotional health of the person. We must understand the primary definition from the WHO of health is a state of complete physical, mental, social, and emotional well-being. So we should not be dismissive about this, and I'm so glad that you chose to discuss this as the first topic to address today on International Women's Day.
So should we go on to the interactive? In fact, we are getting, that's what I was just looking at, because a lot of questions which are also coming on the live feed. But I will first quickly ask you some of the questions that we had discussed. And I think the main concern, as you said, for most people is, at what you said, at all age groups, this hair thinning and fall can happen. But let's first talk about hair fall, and briefly, what are the important causes of hair fall, and of course, what can one do to minimize that, or is it unavoidable?
Well, to some extent it is avoidable, but that depends upon the cause. And let us take, for example, it varies at different ages. So let us take a young woman between the ages of, let us say 20 to 30, who comes with a problem of hair fall. Generally, when I assess such women, we need to look out for one of the most common problems that women face is nutritional deficiency in our country. And that holds true even in Western countries also. we must understand that there is a very essential difference between women and men, in the sense that the hormonal profile in the body is different between women and men. And second, women have their menstrual periods during which they tend to lose a lot of blood, and therefore they tend to lose a lot of iron sources. So through the blood, iron goes out. As most of you might know, iron is what makes, is present in hemoglobin, which is the red part of the blood. So when they lose iron at regular intervals, they need to be boosted up nutritionally. So I would say that nutritional deficiencies are easily the most common cause of hair loss that we have found in all our patients. I've been tracking patients over the last so many years, and practically all of them have improved once we correct the nutritional deficiency. But there are certain other causes. For example, there are certain genetic reasons why women may lose hair. And then you have patients who have the effect of their own hormones on the hair root, which is what we call as a female pattern hair loss. The equivalent for that is the androgenic alopecia, which is what you see in men, otherwise known as male pattern hair loss, which many young men, if you recollect, you'll see at the ages of 20 or 21, they'll start balding, especially with the receding hairline, and gradually goes backwards. In a woman, the female pattern hair loss would affect the central pattern, the central area where they tend to split the hair in India. And that kind of hair loss is also fairly significant. The treatment varies a lot between all these conditions. And I would be failing in my duty if I did not say, mention two very important things. I don't want to go through a whole list because this is the morning time and you are just getting started with your questions. So, but two very, very important areas are sometimes the immune system can work against your own hair. The immune system tolerates a lot. So the hair actually is like a foreign protein. Very interestingly, the hair root is an area of immune privilege, which means it doesn't get affected by the immune system, even though it's a foreign protein. But if the immune system damages, people lose hair in patches. That is what we call as alopecia areata. And if a person suffers from a systemic disease, whether it is malnutrition or whether it is cancer or whether it is an underlying problem with the gut, or even something like a serious deficiency of vitamin D, a variety of internal systemic problems, which we will in the near few minutes deal with, can manifest with hair loss right in the very beginning.
When should somebody, because I mean, everybody loses a little bit of hair. So what is the absolute, when should you seek medical help or have further investigations and so on? And you spoke about nutritional deficiency. So it's only iron that should be supplemented, or there are, so that is after the investigations, what would be the course of action?
I'm very glad you asked that right in the very beginning before people get taken away by the technicalities. Because practically, when patients come to consult a doctor, especially women, they tell the primary problem. And what I find is many of them, before they even just turn around, doctor, I'm losing hair. Do you think it is significant? Now, that's the question which we are faced, because, practically every lady is concerned when she sees loss of epithelium. Now, the issue here is, the hair grows in a cyclical manner. I can explain that to you in more detail in the questions that you come through. So there is a phase when one portion of anybody's head, whether it's a male or a female, is going to be losing hair. So in a woman, there are far more strands of hair than in a man. And the hair cycle is much longer than in a woman, than in a man. So losing, I would say that in general, for a person between the ages of 20 and 40, if a lady is losing up to 50 heads of hair per day, it is considered normal and we need to reassure them. we also need to give them very objective measures to determine, because there are women who panic, and that should not happen, because one of the very important reasons for hair loss, which I did not touch upon earlier, is stress. We do not want women to panic. We do not want our patients to panic, irrespective of what is it that they have. So losing up to 50 heads of hair per day is considered within normal limits, because it tends to grow back. But if there is significant loss, if you can see the thinning of the hair visibly, you can see. And then we also have, sometimes doctors use things like a dermoscope, in which you can actually count the number of hairs per square centimeter area of the scalp. And you can see in what way the hair has actually broken. This is what we call as trichoscopy. Not everybody does it, and it's really not 100% essential, but a good clinician can make it out even with his naked eyes itself. But if doctors want to, they will do a trichoscopy. But if you find that there is a loss of density of hair, then it requires investigation.
So we were talking about stress and hair loss. So now this is something which is also kind of unavoidable in today's day and age. So how much, I mean, like in a sense that, does one have to, stress also causes so many other diseases in the body. So does it play a very major component in the overall the skin and the hair? And what is your one tip to manage stress?
I'm
not one way, everybody has their own way, but just wanted to ask, because stress is a large part of this whole conversation. Yes.
Yeah, I'm very glad you brought it up in that way, because I tell my patients that there is no way in which you can avoid stress. If you can walk into my room, you have to be under stress. I mean, it's part of daily life, but avoidance is not the answer. Coping is the answer. So we have to teach our patients skills to cope. And if it goes beyond the ambit of counseling by me as a dermatologist, then we need to take professional help to counsel. Because one has to learn how to cope with all the day-to-day stresses of normal life. One has to learn to cope. So my one tip is that don't try and avoid stress. That's not going to happen. But please learn to understand that stress is part of normal life. And stress is something you need to learn how to cope with. If you're able to cope with stress, the job is done. Coping skills are many. Meditation, yoga, I strongly believe in all these things. I am not somebody who dismisses anything which does not require a pill to be written by me. I'm not one of those types. I feel that meditation, yoga, sports, physical exercise, socializing, all these things help us to get rid of talking to somebody. I mean, even if you talk over a Zoom call, it really helps to get rid of a lot of stress. And of course, you also need an empathetic doctor, not a doctor who sees you and within the first 5 seconds writes 50 tests.
So that brings us to another aspect of this whole conversation. But before we go into that aspect, we were talking about conversations and being isolated. So one area where universally we've all been affected is the COVID pandemic, which has caused many effects on our body, not just the people getting COVID itself. So first, I wanted to also ask you what happens to the hair and when somebody gets COVID. And of course, we have all these stressors which have multiplied after the pandemic. So even people who are not affected, who are caring for others or worrying about if they are getting or their loved ones are getting. So it's all taken a toll on all of us. But COVID-19 itself, what has been in your experience, what effect has it had on hair?
I'm glad you asked that.
Yeah, and then I will go on to the next thing about the doctors and the treatments.
Yeah, but if you will allow me to explain what COVID has done to your hair, one needs to understand what is called as the hair cycle. So I'll take a moment for that. Hair grows in 3 phases. The growing stage of a hair, which is firmly anchored into the skin and the hair is actively growing. is called the anagen stage. And then it goes into a resting phase, which is called as a catagen, C-A-T-A-G-E-N. It's called the catagen phase. And then the catagen hairs, the roots kind of thin off, and then they are shed. And that is called the telogen phase. The telogen phase is the hair that gets shed off. But when the telogen hair is getting shed off, there will be an anagen root growing inside the hair follicle. So this is what we call as the hair cycle. Now, normally in a male, there are about 1,000 to 1,500 heads of hair. In a woman, there are approximately 3,000 to 4,000 heads of hair between the ages of 20 and 40. Over a period of time, for both men and women, the number of heads of hair decrease. But at a point of time, about 10 to 13% of hair is in that telogen phase where it is being shed off. The growth cycle typically lasts about a year for a male, or maybe 2 years, but in a woman, it can last up to 3,000 days, almost 9 years. So if you do the math, you'll realize that losing about 50 to 70 heads of hair per day is quite normal. That is the maths behind it all. Now, when a lady becomes pregnant and delivers, that's a very, very stressful period for the body. So it tries to conserve energy and does not allow hair growth at that point of time. So most women who have delivered, who are watching this show, will understand me when I say that after delivery, 2 to 3 months after delivery, they tend to lose a lot of hair. And that settles down in 2 months. Now that is what you call as post-delivery telogen effluvium. Now let's get to your question about COVID. COVID has been something which has changed history for all of us, because in this generation, we've never seen anything like COVID. The way in which it has affected our daily lives is too long to go into, but it has been extremely stressful. You mentioned a few areas. People have died. You're taking care. You're scared. There's a lot of misinformation going on about the pandemic. So even people don't visit hospitals for genuine health problems. A person who coughs is afraid to go to a hospital. He may actually have tuberculosis, but ultimately thinks he has COVID. So these are problems which we are seeing in COVID. The stress induced because of this pushes the anagen phase, it cuts short the anagen phase. So it pushes them all into the telogen phase or the falling stage. So we saw that in the first wave of COVID, there wasn't much of hair fall. There was hair fall. It probably depends a lot upon the way in which the hair follicle is also affected. We do not have very many details about that, though we are trying to maintain a registry of skin-related problems with COVID. But, you know, it does not get prioritized when it comes to funding research. Yes. So this is a big problem in dermatology. You don't get a priority for funding what people think is, in inverted commas, cosmetic, and I don't agree with that. Because we need to know how the virus has affected the hair root and why is this shift happening. But what we did see, all dermatologists around the world, that was in the second phase of COVID, a lot of women came to us 2 months after the COVID went away with massive amounts of hair loss. And all of them had telogen effluvium. You can easily just, you don't need to do trichoscopy. You don't need a dermoscopy. Just take that hair, look at the root. You will be able to make out that this is a telogen hair. There is what we call as the pluck test. The pluck test is you just feel the hair and see how well it is adhered to the scalp. And in a female pattern hair loss, you won't be able to pluck it out. But in a telogen effluvium, you'll be able to pluck it out. And you can see that hair root, which will be very near the edge of the growing part of the hair. And that is what we call as a telogen effluvium. We did find this in many patients. In fact, I found almost in the first 2-3 months post-COVID wave 2, I was working every day. I did not stop working. And I found that almost 20% of my OPD was women coming to me with hair loss. Now that is not a small number. 20% come with hair loss. The best way to treat it is with reassurance is number one. Tell them this is telogen effluvium. You've had COVID. It's going to go away. It will take 2 to 3 months. Give them examples of other cases of telogen effluvium. Even typhoid can do it. Malaria can do it. Dengue can do it. Anybody having fever of more than 3 days of 103 can have telogen effluvium. So this is actually post-COVID telogen effluvium. Effluvium means loss. Telogen is that stage of hair. Building up with zinc, with iron, sometimes with vitamin D, helps to recover the hair within a matter of 6 weeks to 8 weeks. So that is the good thing about post-COVID telogen effluvium.
I think we have a lot of questions, so I'm just now wondering whether we should look at some of that. But before that, I wanted to also ask you about, you were mentioning about treatments and about people visiting doctors. But one phenomenon that we have also seen of late is that, there is a lot of, even in the field of dermatology, there is something called cosmetic dermatology with a lot of, you go to a specialist and then there's so many treatments which are suggested, like, apart from the supplements like biotin, or there are some keratin supplements, and then there's also things like microneedling and PRP. So when does, like, are these really effective, and do they have, people often wonder whether they are even safe treatments in the long run. So there is a certain group of people who go to these kind of treatments, and then there is also other people who also do a lot of salon-based treatments like chemical treatments or hair masks or oiling and massages and all that. So what's your opinion about all these things? What actually works and what is safe and not safe, more importantly?
Dr. Srinidhi, you put me on the mat there because there are 8 sub-questions to your...
I know, but this is something which even I personally wanted to
But I'm
ask.
going to answer every one of them.
I think, starting from somebody at home telling you that, you have to oil your hair, and then you go to a
No, I will answer every one
parlor
of them.
where somebody will say, don't oil your hair, you have to do these chemical massages, or, there would be some kind of hair mask or some keratin treatment or some elaborate ritual there.
No, I'll come to it. I'll come to it.
And
I
then
will not disappoint you. It is your
and
day
then
today.
yes, and then there is somebody who says, no, you have to stick all these needles into your hair and inject your own. So I'm sure everybody watching this program this is probably the most important question of the day.
Exactly, and it is your day today, so I will not disappoint you. I will answer every one of these.
Please tell
us. Number one, you see, even if you are an aesthetic dermatologist or a cosmetic dermatologist, you can practice good dermatology, which is based on science, not quackery. Unfortunately, there is a lot of quackery going on. So that's something which we should not encourage. Second, if a patient does not have a genuine medical issue, one should not be made to believe that there is a medical issue. So this is a very important thing, because you go somewhere and you go with the problem, let's say, for example, eyelid which is itchy, and then somebody tells you, look at your cheek or look at your angle of the jaw, and this is a normal image, this is your image. These are unethical. So what you said is quite right. There is a lot of quackery going around, and it is especially so in hair, because number one, women are very particular about hair, and there are so many myths circulating around it that they don't know what's right. And they, somebody who has a white coat and sits with the 10 letters after their name, even if the letters are all not recognized by the MCI or any international body, they become important. So can't blame anybody. But, let's take it from the home. I'll take a question backwards because it makes it easy for me to remember what all you asked. From our childhood, we've all been taught that oiling your hair is good. I will just qualify it, because I tell all my patients who ask me the same question, oil is a very good conditioner for hair. There is no doubt about it. Even normal coconut oil, if some people want to spend money, if they want to spend olive oil, or if they want to use argan oil, but basically the function of all of them is the same. They're very good conditioners. Now, you do not need a conditioner for the hair root or for the scalp, because there is a subsequent question which we need to deal with, and that is disorders of the scalp. So oil worsens, for example, dandruff. So we would advise that you can go ahead and massage your hair alone, which is not connected to the scalp at all, nothing wrong with that. You go back further, and then you talk about things like, where you're told that you can use a keratin treatment for your hair. Now, we need to understand that keratin is a protein which is manufactured inside that hair unit. It is not something which you apply outside and it stays on the hair. It will never happen. So it has to be manufactured. Your nails, I'm showing you my fingernail, is keratin. So I can't apply keratin on my nails if I don't have nails. That's the easiest example I can give you.
Yes.
The nail has to grow from the nail fold. So similarly, keratin has to grow from within the hair follicle. Now, there are medicines which can stimulate the assimilation of keratin. One of them is biotin. The problem with biotin is that it is vitamin B7, otherwise it's called vitamin B7. It doesn't stay for long in the body, and its very good source is through meat, vegetables, beans, and flax seeds. So you can choose what you want and include it in your daily diet. But the point here is that if there is loss of hair and you need to supplement the strength of the hair, you need supplementation of biotin. But biotin is going to help you with the keratin formation and therefore smoother and stronger hair, but it's not going to accelerate the rate of hair growth. I hope the difference between that is very clear. And then, we have a lot of medicines which we use, which are applied on the scalp to stimulate hair growth. Now, one of them is called as minoxidil. And then we have another called as procapil, or we have aminexil. There are decapeptides. A lot of them are used to stimulate hair growth. Now, somebody had this bright idea that instead of giving this as a prescription, you must admire the genius of people who think up of these things. So they said, instead of giving it as a prescription, where the patient can just come, take a prescription, use it at home, we apply this on the scalp and tell them, look, the medicine won't penetrate until we put a needle over it and push the medicine into your scalp. Now, that's a ghastly procedure. I heard of that these things were being done in the medieval ages. Looks like we are going back into the medieval ages. It's my personal view. It's a totally ghastly procedure. And I don't think that it is needed to stimulate growth of hair. You also mentioned PRP. PRP actually means platelet-rich plasma. We need to understand that it is derived from your own blood, and you spin the blood in a centrifuge, which spins the blood at a very high rate, and it separates the cellular elements from the liquid elements, which are non-cellular, and that's what we call as plasma. Now, that is very rich in growth factors. Before you start thinking of PRP as a treatment for hair loss, you need to understand that PRP was first used for treating wound care. So if there was a non-healing wound, this plasma or the fibrin from the plasma was applied into the wound as a dressing because it had several growth factors. And I'm sorry, I'll have to be a bit technical here, but these growth factors are pluripotent. Pluripotent means they're not directed towards growth of only one single cell in the body. They will stimulate the growth of everything, whether it is blood vessels or whether it is fiber or whether it is the skin. All of them will be stimulated to divide because this growth factor is pluripotent. Now, if you inject it into your scalp, now, we have seen cases where wounds which have been treated with PRP have grown bone. Yeah. Now, just imagine if somebody does PRP on your scalp and there are little bony spicules which form. If nothing happens, fine, the doctor takes the credit. But if nothing happens and there are bony spicules which form or non-healing ulcers which form, there is going to be trouble. So this is the reason why the US FDA, this is not my personal opinion, but the US FDA has not allowed PRP for treating hair loss. So I would advise against PRP for hair loss. There are a lot of other options for treating hair loss. Now, regarding this issue about the delivery of a drug into the scalp or the hair roots, You don't necessarily have to move into pushing it to the needle and using medieval torture. The point is that we have better drug delivery systems in place. Now, these are called as nano delivery systems. Nanoparticles are 10 is to the power of -9. That is the size of those particles. So lots of treatments are coming up with the nano delivery system, which can penetrate all micropores present in the scalp and reach deep down. So all this is going to get outdated very soon with newer drug delivery systems and better understanding of the factors which promote hair growth.
Sure. I think we are running.
I hope I covered your.
Yes. And I think that was really very clear. And now I think I'm just going to take a few questions from our audience because I think we're running out of time. So I think we will not discuss the scalp part of it, but instead see what our viewers are saying now. So the first question was, are there any foods that actually cause hair loss?
Actually, you know, eggs, if you eat too many eggs, there are two proteins, avidin and biotin, avidin and albumin. Avidin can form a complex with biotin. I introduced biotin just now, and it can prevent the absorption of biotin. So if you eat eggs, eat it in moderation. Don't eat 8 eggs per day. I've seen people who eat 7 to 8 eggs per day.
Part of some diet or the other, yes.
Exactly. So one shouldn't do that. Second, never do this fasting. Fasting also produces hair loss. It changes the biorhythms of the body. Hair grows according to the biorhythms. Too much of vitamin A incidentally can produce hair loss. People are taking vitamin A supplements right, left, and forward, but that can produce hair loss.
The next question is, can children face hair loss? In that case, what type of doctor do you see for that?
No, for hair loss,
a pediatrician or a dermatologist?
No, I would say that you should see a dermatologist. Second, when children can lose hair around the ages of 7 to 9, the normal phase of transition of the hair growth cycle, which I explained in detail a few minutes ago. So children, adolescents, post-pregnancy, then during the perimenopausal age group, there will be a phase of hair loss where a dermatologist can help you with supplements and finding what is the deficiency.
My hair falls out in the shower, so should I wash it less?
Now, hair falling out in the shower means in minimal amount of pressure or traction, the hair is falling off, which is telogen effluvium. You need to investigate why you're losing so much hair.
So it's not about the washing.
It is not about the washing. You need to be gentle when you wash.
Is it safe for balding men to blow dry? I don't know what that exactly means. But generally, yes, blow dry and other heat.
Blow drying all depends on how far you keep the blower away from the hair. If you keep it too close to the hair and if the hair is moist, it will absorb heat and keratin protein will break, the hair will become brittle. So I would say that if you want to blow dry the hair, keep the blow dryer a little far away from the hair and make sure that the hair is not too wet.
Does frequent combing cause hair loss?
The type of comb that you should use is a wide-toothed comb or a brush. But a narrow-toothed comb and a very sharp comb can sometimes pull out the hair. Yes.
Does shaving increase hair growth?
No.
It doesn't.
It makes no difference to hair growth.
The last question is about COVID, which we have already taken up, about the hair loss after the second time infection with COVID. So I guess we answered that question already. So yes, I think we have covered most of the aspects, and I think, is there anything else that, if there's nothing, then we'll close the session, Doctor, and I do hope that viewers, you have had all your queries answered, and we have had an overall very illuminating discussion by Dr. Muralida Rajagopalan on hair loss. Thank you so much, Doctor, and thank you, viewers, for this wonderful topic. And I'm so glad that we discussed so many aspects about hair care. So now, dear women, you are being crowned with success after success in your endeavors and in your goals and in your life. So do also take care of your crowning glory, which is your hair. Do reach out to us anytime. You know that we are available on all the social media channels to respond to any queries and to assist you. And of course, you can walk into any of our hospitals and meet our specialists for further support and care and consultations. So, signing off now with a salute from all of us here to strong women. May we know them, may we be them, may we raise them. Thank you and namaste.
Thank you, Dr. Srinidhi. It was wonderful chatting with
Thank
you.
you, doctor.
And
Thank you.
thank you to all the audience.
Thank you.